Okay, next up on Annalise's 2-week update, she had the newborn screening done. Any of you that know my story with Wyatt and we think he has VL-CAD and his hospitalization and the hell we went through with that will understand how much I despise the newborn screening. And yet my husband and I feel that it is still very important. We hate it. We fear it. We just, every time. It just drives me insane. But we agreed that we need to know if there were, in fact, something down the road that was really bad or really dangerous. We need to know that. And so we put up with the newborn screening. And again, we've kind of had to put up with it. I have another video. I can put a link below that kind of explains what happened with Wyatt and the VL-CAD thing and what happened with that craziness. But on Annalise, everything looked great with the exception of hypothyroidism. She was just barely borderline, like half a point above the cutoff. Just barely considered needing to be tested again. So we had to bring her in amongst all these funeral plans for my mother-in-law. I'm having to take my baby in to have them try to draw blood out of her, and she's like, this flippin' big. And unfortunately, she has veins like I do. They suck. They're tiny, they roll, they run away from you, they hide horribly. It just sucked. And she's so little. She's so little. She was 5'13" when she was born. The first blood draw, she was right around 5'9", 5'10". It sucked. They poked her 3 times. They didn't get barely anything out of her. It was excruciating to watch her just scream and scream and scream, and obviously in pain, because these needles are huge and she's tiny, and I don't even know how this needle was small enough to get anywhere near a vein to draw blood from in the first place. And they refused. I begged and begged and begged for a heel stick. Nobody would listen to me. Nobody would even attempt it. They just kept telling me we need too much blood. Well, you're not getting the blood you need by stabbing her in the arm. Can you at least attempt a heel prick? No, wouldn't do it. And like I said, the first blood draw we took her to was really, really hard. We had just left the floral shop and had just ordered the flowers for my mother-in-law's funeral. So obviously, nerves very raw. Brand new baby. Mother-in-law just passed away. Trying to deal with everything that's going on. I literally was in a crouch mode and didn't even realize it at first, but I was crouching like I was ready to just attack these women if they wouldn't stop. Because there was one woman that was grabbing and yanking on her arm, and they just weren't very... Their bedside manner sucked. Their tableside manner. However you want to put it, sucked. And they did a sucky job. And it, you hate to kind of say that, but there was one woman who made at least somewhat of an attempt to talk to Annalise, and that helped a little bit, but for the most part, it sucked. I had to take her in a second time to attempt to get another blood draw. Again, it didn't work. We got enough of blood to get a TSH once and a T4 once. Her T4 was fine, but the TSH was elevated. So I had to take her back again yesterday after we finished the hearing test and have them draw blood again. I made sure that girl was so well hydrated and so warm. Because of course they tried to blame me. I had not fed her enough. She was not well enough hydrated. She was not warm enough. How on earth was that child not warm enough? I don't know. But it was completely my fault that they were unable to draw blood from her. So I made sure that all my bases were covered and that they couldn't possibly blame me for it. Again. Okay, I think I have that tickle in my throat under control now. Anyway, took her in yesterday when she was exactly 2 weeks old to have them draw blood again to try and get a second TSH on her. The 2 women that came in, super nice. Like I said, roughly around mine and my husband's age. They were both mothers. They were just really sweet, calm, kept their stuff together, worked together really well, kept talking to me about anything and everything, about my other kids, about Annalise and she had her blood drawn before. They kept me calm, they kept each other calm, they kept her calm. and it worked so much better. They got the blood they needed. They only poked her once. Every other time we'd been there, they had done 3 times, and after the 3rd time, I was done. Not happening. We're not doing a 4th. Give me my baby. They got it in 1 shot. And I praised the hell out of those 2 women and let them know they did a wonderful job, and how much I appreciated the fact that they were so good and caring, and they did an awesome job with her. And we got the blood that we needed, and finally got another TSH run. The good news is her TSH went from 19 down to 9. Good, unfortunately not good enough. The pediatric endocrinologist wants to start treating her for hypothyroidism. So later today, I have to go pick up basically Synthroid for her. I forget what the generic Levoxa, whatever. It's the same medication that I take for my hypothyroidism. It's the same pill, her doctor said. I'm going to have to take the pill and crush it every day and mix it with breast milk or something and try and get her to take it with a dropper or a bottle or whatever, however I can get it in her. She'll have to do that every single day for a couple of weeks. Endocrinology is supposed to call me on Monday and set up a follow-up appointment with her over in with them over in pediatrics, so that they can run another TSH, see how the medication is working, if her level needs to be changed at all, and just see how she's doing. So again, a very small thing, not a big deal. Like I said, I have hypothyroidism. I take Synthroid every single day, with the exception during my pregnancy. My levels, my TSH is actually very well managed with the medication that I'm on. My pregnancy, it got a little wild and we had to up my Synthroid a bit, but other than that, mine is well controlled. I'm sure hers will be too. They said a lot of times when they're little like this, it's something that kind of blows over as they get older and they grow and their bodies mature a little bit more. Sometimes some kids' thyroids just need a little time to mature. And it's very possible that's what it will be. And she won't need to take medication for very long. However, she might be like me and she might have to take it again every day the rest of her life. Again, it's one little pill. It's super simple. It's super easy to treat. And as long as it's treated and her levels are well taken care of, it's really not a concern. Like I said, it's not been a concern for me at all for the last couple of years that I've been treated for it. So, again, I obviously want my daughter to be healthy and perfect and wonderful and have no issues and no concerns, but that's just not always the way things work out. And just like the hearing thing, we hope eventually it blows over, it's no big deal, and it's a story to tell her when she's 15 and bratty. I crushed pills for you every freaking day so that you were healthy. I held your tiny little hand as they stabbed your arm. I desperately tried not to cry as they were making you scream bloody murder. Remember this, young lady. So anyway, she's starting to fuss out there and it's time to eat, both her and me. So, I will keep you guys updated. I will know more in the next month or so, and hopefully, like I said, hopefully everything will blow over, the hearing will be fine, her hypothyroidism will just go away like they say it might, and she'll be back to just being a normal, tiny little peanut. She's tiny. She's only 6 pounds. This girl is just... Anyway, thank you for watching, guys. I will keep you updated as much as I can. Bye.